So, hello everyone, and welcome back to another episode of the Your Head in Mind podcast, where we dive deep into all things mental health. I'm your host, Kyle, and today we are exploring a thought-provoking but controversial topic: the complex relationship between gender identity and mental health. So, joining me is Ann Pellegrini, who is a professor at NYU and a renowned psychoanalyst, who will be sharing insights from their book, Gender Without Identity. So in this episode, we'll discuss how trauma and life experiences can shape our understanding of gender and how evolving views on gender complexity impact mental health. By the end of this episode, you will have a deeper understanding of the intricate dynamics and the importance of fostering inclusive spaces for individuals experiencing these complexities. So it's going to be an interesting conversation, so let's ask some questions. So thank you very much for coming on the podcast, Anne.
Just really pleased to be invited. Thanks so much.
Okay, thank you. So I'll firstly ask you about kind of your background and how did you get into psychoanalysis and what inspired you to write your book, Gender Without Identity?
Sure. So as you mentioned in the introduction, I'm both a professor at New York University. I'm in the Department of Performance Studies, and I'm also an associated faculty in gender and sexuality studies. And I've been teaching at the university level for more than 30 years now. And I'm also a practicing psychoanalyst. So I'm occupying these two different spaces. There are different kinds of spaces, but in both, I often hear people, my patients certainly, I work with a lot of queer and trans people, but also my students, ages 18 up to 40, who are talking about their experiences with gender, for example. And this has been over a really long period of time. And so it's given me a kind of ways to ask questions and ways to think about not just in changing social ideas about gender well beyond the binary, but how people are attempting to make sense of their experiences. And, in the classroom, I'm someone that has for a long time been teaching queer theory and, things to do with the social construction of gender and sexuality. When I'm sitting in the consulting room with a patient, I'm hearing the more intimate account of how these social categories are actually lived on the micro level. And I find this to be this has been a really incredible sort of actually gift. I feel really lucky to occupy these two different spaces, to be able to think at these different levels of gender and sexuality.
Yeah, it gives you a lot of insight from a range of experiences, I guess. So how did you actually get into the field in the first place? Was there a particular point in your life that you were inspired by, I guess, how the mind works?
That's a great question. I've been thinking about and with psychoanalysis for a long, long time. My dissertation, which then became my first book, was actually looking at basically how psychoanalysis has attempted to think about, not always so well, questions of race. And so I was always intellectually engaged with psychoanalysis and what it had to offer as a body of theory, but also quite curious about it as a practice. I mean, the practice of people sitting down together once a week, twice a week, 3 times a week, 4 times a week, and sometimes for many years, and very curious about what happens when you are actually in that kind of space with such frequency and such intensity. And so any psychoanalyst, as part of their training, has to themselves be in a psychoanalytic treatment. I had been in a psychoanalytic treatment even before starting my training as a psychoanalyst, but I had a keen intellectual interest in psychoanalysis and a really strong curiosity. And I think over time, I wanted to actually know more about psychoanalysis, which sort of led to my deciding to add on to my full-time life as a professor, the practice of being a psychoanalyst as well.
Okay,
but I'm really curious about, you asked about the mind. I think I'm actually, in some ways, I am curious about the mind, but I'm actually really curious about the things we don't know about ourselves and what can happen when we put less pressure on ourselves to know so fully, like to actually be curious and be surprised by actually what we want, about how we're responding to others, how we're responding even to ourselves. And so, like, in some sense, this is a different way of thinking about the mind. It's a mind that also includes parts of ourselves that we'll never fully understand. And that need not be frightening, though it sometimes is. It could actually be a resource for something else.
Yeah, I get that. And that is interesting. And for those of our listeners who don't even know what psychoanalysts do or what they are, could you just explain kind of what it is?
Sure. Well, this will be a very condensed and partial version, But, psychoanalysis as a practice is, it's, we could say it's connected to and related to other forms of, say, psychotherapy and psychological treatment. It traces itself back to Sigmund Freud, and then there have been many other important psychoanalytic thinkers since him. But one of the things that distinguishes psychoanalysis from other psychotherapies is that psychoanalysis does ordinarily involve heightened frequency. So you're not just meeting once a week. It is, and usually more than twice a week. I mean, like you're meeting 3 times a week, sometimes 4. Some people even meet 5 times a week. And that intensity of sitting with someone and actually, in some sense, exposing yourself in the sense of trying not to censor what you're saying, which is far harder than it sounds. This makes it possible to experience your feelings, to perhaps hear yourself saying or feel yourself saying things that even surprise your own picture of who you are. So as a technique, as a practice, psychoanalysis already has some important differences, just again, at the level of frequency and intensity. It's in that sense different than a once-a-week treatment. And psychoanalysis, which is quite plural, I suppose, in terms of its quote-unquote theories, does share some basic ideas that take seriously that there are important facets of who we are that are unconscious. They are beneath, outside, resist our knowledge, our cognition, our consciousness. And not only that, in some versions of psychoanalysis, we'll never fully be able to make those unconscious feelings or ideas conscious.
Yes.
They're always going to resist that attempt. And that this makes room for lots of surprises, sometimes pleasant and unpleasant, but it's a very different way of picturing, I suppose you could call it human mind, but a way of picturing just how de-centered we are from our very selves. We're not as unified as we might think we are.
Yeah, that's a great answer. I've heard lots of things about, the power of the subconscious mind and only how our conscious minds are a very small part of that. So yeah, it's very interesting to hear that. So the idea of trauma influencing gender identity is quite controversial. I think you might agree. So what led you to explore this connection, and how has it been received by the academic and the LGBTQ plus communities?
Sure. Maybe I'll back up a little bit. So I co-wrote this book, Gender Without Identity, with another psychoanalyst, Avi Sakatopoulos. And we were both psychoanalysts. So we wrote this book drawing on our clinical work, like our work sitting with patients over many months, many years. And we're also in the book drawing on really exciting developments in a body of academic literature called queer theory and queer and trans of color critique. So we're drawing on these sort of different kinds of experiences, different kinds of reading. And we wrote this book to make an intervention both into debates happening in the clinical world amongst psychoanalysts, but also amongst psychologists and psychiatrists and other psychotherapists and mental health workers. So we're trying to intervene in debates in the clinical world. And we're also trying to intervene in cultural conversations, specifically to do with gender expansiveness, queerness, and non-binariness. Right? And this then will connect to the question you asked me about trauma. In both clinical conversations, but also too often in cultural debates, it is both assumed and argued that if there's any relationship between trauma and someone's transness or queerness or someone being gender expansive or gender non-binary, if there's any relationship between trauma and those kinds of sexual and gender queerness, non-normativity, then that trans identity, that understanding of oneself as queer, must be invalid. It's only an accident caused by some negative experience, trauma. And so if we can address the trauma and cure it, we can return someone to the straight and narrow of binary gender and heterosexuality, right? So there's, again, both many clinicians and in cultural debates, the idea is that trauma plus transness, trauma plus queerness equals invalid, right? And as against this association between trauma and transness or trauma and queerness as invalid, those of us who want to affirm and validate queer and trans life, it has seemed like we only had one option, which is to say that nothing causes transness or being gender non-binary or being queer. Someone's just born that way. So just like someone's born heterosexual or born cis, this new term cisgender to describe someone who's normatively gendered and for whom that feels like the right fit, right? Just as someone's born straight or born cis, so too are trans people born trans, queer people born queer, non-binary people born non-binary, right? So this, now that's settled. We don't have to talk about trauma. And in our book, Avi and I take a very different approach to this question. We plot a very different path for thinking about the relationship between gender and trauma. And one of the things we suggest, and I'll say this and then we can, I'll pause because I bet you have lots of follow-up questions, right? One of the things we're suggesting is that all gender, not just non-normative genders, not just transness, not just being gender queer or gender expansive, but all gender has some relationship to trauma. And that it's inextricable from gender to have some, again, relationship to trauma. So that trauma doesn't invalidate. Trauma could actually be a resource, some of the material out of which someone fashions a gender that's a good enough fit for them, right? And this is a really different way of thinking about the relationship between gender and trauma. And it's also a relationship that refuses the pathologization. The way we're talking about gender and trauma refuses the pathologization of trans and gender expansive people. And we're also saying that this is the case for even normative genders. Like there's no gender that escapes contact with trauma.
Yeah. Yeah, that's interesting. So a follow-up question to that is, obviously this is an interesting perspective to look at things, but at the same time, do you think that, I know you addressed that it's, as people say, it could be potentially harmful in the sense of, people who are trans, they might feel invalidated, or people might use it like, as you said, they may say, oh, it's like mental illness, for example, but which for them, it's something that's always been, intrinsic to them. And how could this ever be formed? Do you think that exploring this idea could be harmful, or do you think it will be more of a benefit to people in that community?
I really appreciate this question. I think it's a very important one. And when writing the book, Avi and I gave a great deal of thought to this. We're ourselves members of the queer community. It's a community we care deeply about. And we were very concerned that by making an argument against gender identity as immutable, born that way, that the arguments we're making could be weaponized against trans and gender non-binary and genderqueer people like this. And it's something we talked about over and over in the course of writing the book. And we took such care in the hopes that our words could not be twisted out of context. And we talked to colleagues, many of them trans themselves, about how to avoid that kind of weaponization. And our colleagues said something to us that was incredibly helpful, which was that we needed to give up the fantasy that we could so control everything we wrote that it couldn't be distorted. Because that's actually a fantasy. Like every author, I think, wants to think that they can control how the reader receives their text. And so that's just in a general sense, we don't actually get to do that. But especially if there are malicious political actors who want to distort what we're saying, we can't stop that kind of distortion, that we've tried to write and argue with extreme care for that possibility. We know we can't avoid it entirely. But the other thing I'd say about the association we're daring to make between gender and trauma, and again, we're arguing against born that way as the justification for the not discriminating against trans and queer people. I'll say this. The reason not to discriminate against queer and trans people is not because queer and trans people are born that way. It's because it's wrong to discriminate against queer and trans people. There's nothing wrong with being queer or trans, and there's no wrong way to become queer or trans. We should not discriminate against queer or trans people. And the born that way argument is, we think, politically and ethically insufficient. It's politically insufficient because it hasn't actually worked to immunize queer and trans people from assault. It hasn't stopped them from being assaulted literally, like beaten up. It hasn't stopped legislative and policy assaults, not just in the United States, but in Britain and numerous other contexts. So it hasn't worked politically. And it's also ethically short-sighted because, again, to say that the only reason not to discriminate against queer and trans people is because we're born that way is to suggest that, well, we can't change, can't help it. But if we could change and could help it, it would be okay to discriminate against us. That's a defensive position. And it doesn't actually stand up for queer and trans people by saying, hey, what a wonderful way to be. And there's nothing wrong with being queer or trans, but how great, we're making just defensive arguments. And I'll also say epistemologically, we think it's short-sighted because as analysts, it makes no sense to say that someone's born that way. It doesn't account for the transformations that so many people experience and knowingly experience, let alone the transformations that happen and that might be a little bit more beneath the surface. Like I think Avi and I just don't believe that anyone is quote unquote born that way, even as we understand and want to validate the fact that many queer and trans people would say of themselves that they were born that way. It's the language that makes sense of their own internal experience of a kind of, it's longitudinally the case they felt this way. It feels like a continuity, and born that way best expresses that feeling. And we want to validate that because in a culture that wants there to be as few queer and trans people as possible, any way that a queer or trans person gives an account of themselves needs to be validated, right? But many queer and trans people would not say of themselves that they've always been this way, that they feel born that way. So we also have to make room for those self-accounts. And we think the model we're offering, which is to think about gender as a process of becoming, not as a static ontology, not as a static state of being, and as gender that is very often connected to some kind of trauma that could be some of the energy for that becoming, we think this makes a lot more room for different ways to be trans and different ways to be queer.
Yeah, thank you. Yeah, I understand that. Well, one of the ways that I look at it is when you're born, for example, you're continuously developing, your brain is continuously developing, right? So, I mean, what is the difference from obviously being in the womb to outside? Like the brain is still going through this developmental process and is subject to change. Like you can see yourself, compare yourself to 10 years ago, you're a different person really. So you're always going through this mental, psychological change. So you wouldn't say how you are now, you're born that way. You're always open to the world and stimulus around you. Would you agree with that?
I would. And I think that this is, important to think about how there's an external world and external stimuli that actually come inside us and can be shaping. But that doesn't mean it's like a determined relationship in the sense that the world comes in and we're just like, there you go. It's like a kind of fatalism of the external. There's some kind of ways in which we respond to those external stimuli that's not fully volitional in the sense that here's my menu of stimuli, here's how I'm going to respond. But there are things that happen that this is where psychoanalysis, I think, is such a rich resource. There's something idiosyncratic that happens. And it's idiosyncratic having to do with things that, again, are not reducible to a formula. There are all sorts of accidents that happen, accidents that then we can maybe make our own and come to feel like, oh yeah, that makes a lot of sense for me.
Yeah, I agree with you. So I'll ask you another question, which is about the relationship between trauma and gender identity. So, have you observed any kind of specific patterns in your clinical work that has led to this hypothesis, or is it? Yeah.
Yeah. Actually, I'm going to even back up from the clinical right now and maybe give an example that would both respond to this question, but also maybe pick up on something you just said before, which has to do with the ways in which, there are all sorts of ongoing transformations that people experience, right, throughout their lives. And not all of which, actually most of which don't have anything to do with gender. Gender, might name a particular set of experiences and transformations, but there's so many different ways in which we change. Our interests change, the career paths. I mean, like things this is very mundane, but meaningful, right? And I want to give the example of the transformations of actually femininity in the sense that, and this has to do with trauma as well. Remember I said earlier that we're arguing that all gender has some relationship to trauma. This isn't just about transness, people who are non-binary, people who are genderqueer, but all gender, including normative genders. So we live in a profoundly misogynist and patriarchal culture. And so to be someone who's assigned female at birth, raised to be a girl, who becomes a woman, I'm thinking of someone who actually understands herself to be a woman. This is someone who was, again, assigned female at birth, understands herself to be a woman. This is not about, am I really non-binary or am I really trans? Like someone who understands herself to be a woman. Part of the meaning, part of the experience of being a girl who will become a woman is shaped by the threat of violence, whether the threat or the actual experience of sexualized violence. And again, this is all too present in the lives of women. So to be a woman in a culture that in which misogyny is so epidemic is to have the meaning of one's gender shaped by trauma. Let's say, again, the actual trauma of sexual violence or the trauma of always having to sort of organize your life to avoid it, right? Girls and then women are constantly told to be careful of their surroundings, to mind what they wear in public, because if something bad happens to them, it's going to be their fault. Don't be too sexy. I mean, like, this is part of the ongoing fabrication of what it is to be a normatively gendered girl who becomes a woman in our society. So that's one thing I'll say about, I don't even have to go to the clinic to think about that. We can sort of, I think this will probably resonate for many of your listeners, right? That this is just part of the experience. Like, it's just taken for granted that this is sort of how femininity works, how girlhood and then womanhood works. And that I also want to pick up on how, again, normative cis femininity. I think for many people who understand themselves to be women, again, they've been assigned female at birth, girls who became women, how they experience their gender is likely going to be changing across a lifetime. It's not the same thing to be a girl before puberty as after. Are you a woman who's had children, who hasn't? What happens with menopause? Just even your own experience of your gender may shift. Your own experience of your womanliness may shift. And this, again, very mundane, very banal. And we don't usually understand those shifts in how someone's experiencing her normative femininity as being a gender transition. We tend to reserve that term for something that seems like a category change, I suppose. But what if these are also thinkable as kinds of gender transition? And we can maybe de-dramatize what we understand by transition by saying, actually, I think we're all of us transitioning in our gender throughout our lifetimes.
Yeah. Oh, that's really interesting. I'd never actually thought about it in that way before. I've always had this idea, of there's perceived gender roles, for example, but I'd never really tied that into, traumatic experiences and how that can shape, I guess, an individual's relation to gender. So, yeah, from my perspective, as you were saying, both, I guess, men and women have their own respective gender roles, which have been passed down through society for years. But then you just got to think, what if there weren't any of those perceived gender roles there? What would gender even be? What would you define gender? What would you define gender as? Because without these preconceived roles and little boys play with blue toys, little girls play with pink, what would the actual result be? There wouldn't really be a separation in a sense, would there?
I'm thinking about little boys playing with blue toys and a little girl with pink. And we know that historically, earlier in the 20th century, in fact, it was like, in the 1930s, it was the opposite. Pink was thought to be a very strong and virile color. So pink was a boy's color and blue was a girl's.
That's interesting.
Right? So now it's the opposite. But, there's still the sense that there are, I was going to say, there's boy and there's girl. They're different. Again, we have an expanding conversation about the fact that gender, there might not be as binary as we think, right? We have many living examples of the ways in which gender is not binary. I think that, I can't tell you what gender is. I can tell you that actually one of the arguments that Avi and I make in the book, we're trying to resist the idea of giving a definition of gender per se, because we don't think that there's any such thing as a true or a false gender, that gender is what feels accurate to that subject's experience at the time she, he, or they were experiencing it. Like gender, and that's gendered self-understanding can shift. And part of that shift in how someone understands themselves may also shift, and this is where this question of the external world is so important. We live in a world where even as there's so much homotransphobia, that we can't deny that, yet it is more possible to know about and even to become trans and to become non-binary because there's more cultural conversation. Children and adults too are seeing more representations. There's more language available. So there is in the external world more, let's say, there are more things to grab hold of as a way to describe and name the gender you're experiencing. There's an increased vocabulary, right? So, and this also has been made possible by feminist pressures, a century plus and counting, all sorts of feminist pressures on binary gender roles. And by putting pressure on sex role stereotypes and on gender roles as separated between men and women, that's actually open space to be not just a man or a woman, right? It's actually expanded gender. It's been part of what's helped to expand gender beyond the binary, thinking about the United States, but in also other national contexts, right? So it's what gender is actually still undergoing mutation.
Yeah, I find like you said about gender obviously is not binary, and it is fluid in the sense, and it reveals of whatever's personal to the individual. And a lot of these things I haven't thought about in a lot of depth, but it kind of makes sense in the form of it is very personal, and it is your experiences and how they shape you, I guess.
And I think this personal dimension is really important. And there's a personal dimension that's never only personal, because we are not raised in isolation. We're raised by at least one other human. In fact, as the kind of mammals we are, the neonate wouldn't survive for very long if there weren't at least one adult caregiver looking after bodily temperature, providing nourishment, holding, right? So we never exist in isolation. So what's personal has always been inflected by the interpersonal. And since, I'm a psychoanalyst, and it also has to do with what we're sort of in the internal life of the interpersonal as well, right? It's not just fully up here and cognitive. But it's not just the family, right? It gets wider and wider, because families exist in larger contexts too, in communities and a larger society. So there are all sorts of messages that are, again, we could think about these messages to do with dominant notions of gender. And those messages are also, now there are other messages, not just dominant notions, but let's say queer notions, feminist notions. There are competing ideas about what gender is, what possibilities are. And those are in a larger society, say, the big envelope. But inside that big envelope is the smaller envelope of, let's say, how the family is making sense of those messages, which are part of what gets passed on to this little person who's going to become an adult. So we've got a big envelope inside that, a smaller envelope. And then there's me having to make sense of all these things. And then also my internal life that's not fully about, cognition and consciousness. So we have this really interesting set of interactions. And so that I say this because to say that the personal really matters, and it never takes place in a vacuum.
Yeah. So,
and it's also not, I'll just say one more thing. It's also not that the outside directly tells you who you're going to be. There's some give and take.
So this kind of passive influences that you might not even know that are affecting you in a way. You're like a sponge, essentially, taking on both external cues.
Although I think that we, certainly in the book, we would not say we're just sponges, because that makes it seem like we just soak it up, and there's no resistance. We just, we're told we're going to be this, and this is what we are. We have all sorts of evidence that it doesn't work that way, because if it were the case that we are determined by the social messages we get, and if we're looking, say, at a family that's very restrictive in its notions of gender and sexuality, it would be hard to explain how such a family, which was very restrictive and letting its children know about the very existence of trans and queer people, how could that family have a gay kid or a trans kid, right? It's not just one-to-one. The outside comes in. The parents tell you, be this, don't be that, and it works. We know over and over again it doesn't. And this isn't just about gender or sexuality. Think about how parents are constantly surprised and can sometimes respond with not just frustration, but disappointment and anger when their children no longer want to stay within the religion that the family raised that child in, or that the child wants to take a different career path than the one the mother or father wanted, right? Children constantly surprise their parents. We know it's not a direct relationship between outside messages and the kind of person you become.
Yeah, Yeah, I appreciate that. That it's obviously much more complex than just being a sponge, as I said. So, in going back to for trauma, for a trauma focused approach, so how can trauma complicate or influence the process of understanding one's gender identity, in your opinion?
Yeah, that's terrific. So one thing to say first is that, so as I mentioned earlier, this is the book Gender Without Identity. I co-wrote it with another psychoanalyst, Avi Sakatapoulou. And Avi also published another book in 2023 as well called Sexuality Beyond Consent. And in that book, she really fleshes out something she calls traumatophilia. And this is a concept that was utterly necessary for us in our book. We couldn't have made the arguments we made, linking gender and trauma in the way that we did without her prior argument. And what is traumatophilia? So traumatophilia has the words, basically has trauma plus philia. Philia means sort of love of. And by traumatophilia, we're not saying love your trauma. This is not a romance of trauma, but it's trying to think about trauma as something that isn't just something we should imagine we can do away with. That it's not only bad. Again, it's not like we're not trying to idealize or romanticize trauma, but there's a tendency, not just in psychoanalysis, but in other forms of mental health counseling, and I'd argue in popular conversations about trauma. I mean, you don't have to ever have been in therapy to be able to use the term trauma meaningfully, right? It's a word that's just circulates in our culture. And we tend to think of trauma as a really bad thing. It's an injury, it's a harm, and a profound one. It's somehow qualitatively different. And actually, and quantitatively, it seems to have a kind of charge that other kinds of injuries don't have. It's a special kind of injury. And it's bad. And not just bad, like it was an injury, it was harmful. Trauma is generally thought of as something that's it's like it's the worst thing that ever happened to you. And it stopped you. It broke you, right? And that you never recover from it. Or actually, you need to recover from it, right? And this way of seeing trauma leads so often clinicians to think, all right, well, our task is to heal that trauma, to repair, to stitch back together this person who's been broken. And it can lead those who've experienced trauma to think that what they need to do is heal that. And again, not trying to romanticize trauma here, but trauma is actually never healed. We can't fix our trauma or undo it. The challenge, and it's a profound one, is how do we live with something that happened to us that we wouldn't have chosen? And it happened to us against our will, or this is also complicated. Maybe something happened to us that we initially thought we wanted, and then suddenly it turns out, oh no, I didn't want this at all. And that can feel traumatic, right? Trauma itself is, we can't undo it. So how do we live with it? And the question, how do we live with trauma? What do we do with it? Is the traumatophilic approach, right? The traumatophobic one is trauma, bad, bad, bad. It breaks us. We have to fix it. Traumatophilia recognizes the harm trauma can do, but also it says, all right, so this has happened. What does trauma also open up? What in the breaking open might become newly available? Again, I don't mean, this is not about romanticizing trauma. Yay, people, go have some trauma. It's given that trauma has happened, what can be done with it next? What do people actually do with and out of their trauma that might help them fashion a life for themselves that is flourishing, that is to be desired, even if the inauguration for it is not something they would have chosen? You can still make a life out of trauma.
So would you say
that is worth having?
So would you say it's more about accepting the trauma that it's happened and that you can't change that it never happened, but then just accepting it for what it is and kind of moving on, would you say?
I think it's exactly about moving on. And I think the other thing is that one could say one is moving with, not moving on, because moving on suggests, again, that trauma is left behind you. And then the other thing, again, it's a nuance, but I think it's important because it's like how to reframe the cultural conversations we have about trauma. We're moving with, not moving on from. And also, we might not fully understand everything that happened in that trauma. Some aspects of it, we might keep narrating. We might still keep making sense of and making sense with. It's not like this, something we might ever fully finish understanding. And that very uncertainty of the ways in which we may never fully understand itself could help make possible some energies. Trauma is also about energy, a loosening up of something. This may help keep those energies circulating in ways that we can change, as opposed to being stuck fully to what we understood as our injury. Again, people have experienced profound traumas. This is not to dismiss that, but we do things out of them and with them.
Yep. Well, yeah, I'd just like to, the people who've been listening to the podcast will know that my whole idea of this podcast and of the platform in general is come from my own experience of trauma, a traumatic episode from being in the hospital. So I guess it is also, you can have positive outcomes from it, but it's not that if at the same time it's like it was a bad thing, but not trying to, idolize the trauma, like you said, like traumatophilia, but it just like accept, oh, this happened because of this, So there can be, I guess, positive outcomes and changes from traumatic episodes.
And what's also important is that these changes, the things one does with trauma, also involve agency, that we're not just the passive victim of a trauma. I mean, we may well be victimized by someone or something, but we're not only passive. Again, that there's something we can do next. And, here's a banal example, and it maybe also can flesh out what one way to think about how trauma and gender always have some connection. And here's a different way of thinking about that connection. We currently occupy a culture, I'm speaking to you from the United States, where one is expected to have a gender, to be able to name it for oneself and to others. Now, there may be circumstances in which you might feel like you can't name your gender. You might be at risk if you do so, but we're expected to know what our gender is. Ideally, we should be able to name it to others and tell them what this is. And our gender is imagined to be legible to other people, so that if they look at us, they're supposed to be able to know at a glance to which gender we belong. This doesn't always work out in that fantasy, right? But again, we're demanded to be a subject of gender, to know it, to name it, to proclaim it, to wear it on and as our bodies, right? We don't get to opt out of that. For all of the talk about gender abolition, I want to refuse gender, we live in a culture that demands it. We have markers on our birth certificate, on our licenses, on our school papers, right? We can't avoid it. Maybe we press back against it by refusing gender binary, by coming up with new pronouns and different ways of naming gender. But we're still in gender even when we do that. Even these new genders are still in gender. So we don't have a choice about being in gender or not. We could call that a trauma. We're told, we're actually given a name. It's a boy, it's a girl. Not just at birth, but even before birth. So many parents have prenatal testing and they already know the quote unquote sex of their child. You have to work really hard as an expectant parent not to be told the sex of your child. You have to say, I don't want to know, because they're going to tell you, right? So this is a demand that's put on us even before we're born. It is to that extent a kind of, we could say, lowercase t trauma. This is a category that will be profoundly shaping of our life experiences, our life possibilities, how we experience our body, how others experience our body, what risks we might face by virtue of that, right? We don't get to opt out. That's lowercase t trauma. But we get to do things in this category we did not get to choose. We didn't get to choose it, but we get to do things. We can come up with different ways of understanding what it means to be a cis girl and cis woman. We can come up with different ways of understanding our bodies such that we come to identify as genderqueer or trans, right? That our agency as gendered beings is not limited by the demand we take up a category of gender. It's the starting point of the agency that would do something with the category we didn't get to opt out of. This limit, this constraint, is the start of our agency, not its obstacle.
Could you give any examples of how any traditional views of gender identity might overlook or misinterpret the role of trauma?
Sure. I mean, I think, and I think this point is worth underlining, right? I think certainly in psychiatry, in much psychoanalysis, and in other psychological, let's say, sciences, and also just outside the clinic, in many popular conversations, it is assumed that let's go to the issue of trans children who are so embattled with so many legislative attempts to block trans kids' access to gender affirmative care in the United States. And certainly I know this is a huge issue in Britain as well. It's happening in Australia, other countries. But there are many people who think, clinicians and people who aren't clinicians, who think that a trans kid isn't really trans. Something bad must have happened to that child. Maybe a bad internet site, the wrong kind of teacher, the wrong kind of adult influence. They should never have been taken to that drag queen story hour, some sexual trauma. So something happened, something bad, trauma, to throw this child off course. So again, if you treat the trauma, you cure the child's mistaken notion that they're trans. So here, transness is understood to be a symptom of the real issue, which is untreated trauma, right? And this view of the relation between trauma and transness treats transness as a pathological symptom of trauma, right? And this is actually a very dominant view in way too many clinicians, and it circulates in cultural conversations as well, again, outside the clinic, about the relationship between especially trans childhood and trauma.
Yeah, so the point that you made there was, as in the individuals who will see this trans child and they'll think, that's a problem, essentially. Like, they are that way because of some trauma. Something went wrong. But going back to what you mentioned previously as gender being a fluid, that, the normal cisgenders, like, they're not seen as the problem. So they don't think that is a result of trauma. So it's essentially just a circle. So it's only because of the view that is perceived as being wrong is that they think trauma has an influence on that, whereas you're saying that trauma has an influence on everyone's genders, no matter what, and it's basically just the kind of worldview that people being trans is not normal, that then they use that as trauma as an argument for that.
Yes, I think that was very well put. I mean, I think that with these dominant positions, or the normative positions of assuming binary gender of male, female, boy, girl, man, woman, right? That these dominant notions, because of dominance, dominance also means like normativity. It's actually sometimes hard to see all the things that go into making the normal, right? It's just taken to be like a state of nature. It's natural. And one of the things that was really striking to Avi when we were writing Gender Without Identity is that we were initially thinking, well, psychoanalysis, doesn't demand of gender normative subjects that they give an account of themselves. It's always the trans subject, the gender queer subject, the queer subject who has to explain where they came from. And psychoanalysis doesn't, sort of puzzle over normative femininity or normative masculinity. And we actually had this kind of like duh moment where it's like, no, actually psychoanalysis, its literature is like filled with case studies of the vicissitudes of normative femininity and normative masculinity. It's, even Freud is in his earliest papers is actually thinking about how the girl becomes a woman and how complicated that is, how the little boy becomes a man, how complicated that is, and all the ways, all the struggles of that, the difficulties. It's an achievement, not something that's automatically going to happen. So psychoanalysis already has a really actually rich history of thinking complexly about masculinity and femininity as complex becomings, right? That involve struggle, pain, as well as pleasure. So why couldn't psychoanalysis, which has, I think, has some really singular possibilities of thinking about transformation over time, why can't it also give to trans and queer subjects the same grace of thinking about transformation, of struggle, of pleasure and difficulty with complexity and without seeking to cure, right? Just to stay with someone's experience rather than seeking to correct it.
Yes, exactly. So do you think, playing into that, understanding people who are trans, for example, do you think that understanding of the impact of trauma on mixed in with gender, do you think that will have an impact on the mental health treatment for those who identify outside of traditional gender norms?
We hope so. And, I should say that, psychoanalysis has a very long, complicated, and unfortunately violent history when it comes to homosexuality and transness. And also, it has also not been great on racial difference, right? We could say it has a lot of blood in its hands. And That said, there certainly is a growing number of clinicians in psychoanalysis and in the other psychiatric and psychological practices who want to affirm trans people and gender expansive people, who are trying to think more complexly about these issues. It's an important growing minority of clinicians, right? So there already are people who are working very hard to be more attuned to trans people who come into their practices for treatment, and to listen and to follow the patient's narrative of their experience, not to assume that we know best, right? To really listen and follow, because actually the patient's in charge, not the clinician. So that's the first thing to say. But the other is that one of our hopes would be just at some, this is one level, right? That the trauma of transness also involves the trauma of transphobia. For many trans subjects, one of a key source of the trauma they're experiencing is the trauma they're dealing with in a culture that wishes they didn't exist at all, right? So that it would be very helpful if clinicians took seriously, transphobia as part of what they're seeing and hearing, right? And not assume that this is the trauma that caused transness, A, and B. Then we also need space to think about how, again, indeed, negative experiences may have been part of what someone then did something with, made something of, in their own idiosyncratic way, as they fabricated their own gender. And when I say fabricated their own gender, again, I don't mean someone sat down and fully consciously was thinking about what gender shall I be, given that this thing happened. It's like what we do, how we respond to things that sort of affected us. And it's not fully in our control. And yet we get to it's a queer kind of agency Avi and I talk about. It's like you get to do something, but you weren't maybe the first author of it. But ideally, it will come to feel like your own. That this gender will feel like it fits you.
And I'm sure that's very empowering for individuals who feel that they can have something they can identify in that sense. Whereas before, when there's only obviously two genders out there, but set by society, when you have kind of something where you can feel more, I guess, personalized with it, would you say that's quite empowering for an individual?
I think it can be absolutely enabling, right? To be able to be more in one's body, to be more in oneself, to feel like there's a fit, a goodness of fit, and that it's a good ongoing launching pad for daily life, to be sure, and for relations with others.
So I'll just ask you now more about, the reception of the book and, guess your work in general. So, your views have been shared widely, including the New York Times and at a lot of conferences. So how have audience reacted, and have you had any challenges when presenting this theory?
I think we've been extremely gratified by the response to it. We wrote this book. We wrote it in a way that we hoped would be accessible, or accessible enough so you didn't have to be the clinician to read it. We know that it can still be dense going in places, but we've been extremely gratified that it's not only being taken up by other clinicians, by psychiatrists, psychologists, psychotherapists, but it's also being read, we know, by people outside these fields and in sort of, trans and queer communities. We know it's being taught in classrooms. And so we're super excited that it will be taken up by others. And then also those readers will do something with it themselves. They'll think about, how does this help us think about, I don't know, current, anti-trans legislation? Or how does this help us think about what would be a good technique in the clinic? Like we want people to actually, well, this is hard, right? As an author, you have to let go of your book and let others do something with it. If you're lucky, others do want to do something with it. And then we've been both gratified to see that it seems to be hitting a nerve that for many people, it makes a lot of intuitive sense about how they've experienced their own genders and sexualities, and especially in response to trauma. And I'll also say that, even as Born That Way has been a kind of familiar refrain with respect both to gender and sexuality, it's been like a political banner that we wave. Queer and trans people amongst ourselves, this is like, we have much richer language, right? And so I think there's been a relief for many people to encounter this book and be like, oh yes, this is actually what we've been talking about. And so I think that it's made a lot of sense for people, and in ways that we're thrilled that that's the case. There's also pushback with the field of psychoanalysis. There are also some very conservative views around transness, and it's the case that psychoanalysts in Britain, Australia, the United States have been very active writing papers and promoting these ideas that have actually helped to inform anti-trans policies and anti-trans laws and anti-trans legal opinions. So there are certainly people within our own field who would argue strenuously against our claims, and that's okay, right? This is academic freedom, right? We should be able to have these kinds of debates, but I will also say that I'm deeply concerned about how conservative psychoanalytic accounts, those are being weaponized against trans people and against queer people, and especially trans kids, to make it hard for trans kids even to exist.
Yeah, I guess that's the downside of having these conversations. But I guess you're giving this perspective, which could hopefully, help and empower people for the right ways. So why do you think some of the reactions are so strong, and what do you think the reason for bringing this to public discussion, going on to podcasts? What do you hope to achieve by putting this out into the public?
Yeah, we live in a moment where the attack on trans children in particular, and I'll speak about the United States, which is where I'm based. Like this year alone, we're now in October of 2024, but more than 500 anti-LGBTQ bills have been introduced into legislatures around the country. This is the highest number ever. Now, of those bills, a huge number are focusing on trans children, banning their access to medical care, making it impossible for them to use their preferred name and the preferred pronoun in the schools. Like teachers are not allowed to use the names that these children use. And then in some instances, even the parents say, please use this is my child's name. This is how my child understands himself. And I support that. Teachers in some instances it's against state law for them to use a child's preferred pronoun or new name, right? Trans girls are being barred from playing on school sports, right? We have law after law going after trans kids, trying to make it impossible for them to exist. And this is a wedge issue because it's, this is about all trans people, because in fact, we know from the statements of anti-trans activists that they actually want to get rid of all transgender in public life, all transgenderism of public life, as Michael Knowles said, or at least to make it impossible for trans adults to be out in public because they can never use a public restroom because they can't change the markers on their licenses, right? So it's actually very dangerous. If they got pulled over for a traffic infraction, there'd be a mismatch between the sex on their driver's license and how they present and understand themselves, right? But we could say, like, why trans? Why is this a huge issue? Like $50 million in ads and anti-trans ads are being put into the presidential campaign of Donald Trump, right? So our airwaves are being inundated with anti-trans ads to promote Donald Trump's presidential campaign. You're like, again, why trans? So trans is seen as an assault on binary gender. And in that sense, it's seen as an assault on something that is the building block of normative family life. And the normative family is basically the bedrock of American nation. So transness is actually being seen as a threat to the American nation. How can you make America great again when there are trans kids, when there are trans adults, and when there are queers more generally? So I think, our book is certainly not going to undo those things, but we're trying to crack open more space to talk about these issues. And we're trying to do so in a way at a moment of really extraordinarily heightened danger for trans people, for trans kids in particular, and where attacks on transness are part of a much broader authoritarian flex, right? So if we can just, contribute in even one small way to sort of having to think more complexly about gender, we hope this, again, to create more space. How do we resist the authoritarian drift? How do we push back against it? And one of the things we need to be able to do is think, because authoritarianism is telling us not to think. It does that thinking for us. So, our book makes complex arguments. That's part of the point, that complexity is actually something we need in the face of all sorts of counterclaims that tell us, don't think so much. It's so simple. It's much simpler to go to the black and white. It's only these two things.
Yeah, definitely. And it takes effort, I guess, to even get to think anymore about what could there
Mhm.
potentially be, and maybe even people to challenge their own beliefs about things. That requires mental effort. So yeah, as you say, the more you talk about it and the more you kind of incite people, that I hadn't really even thought about this, but now speaking with you, I'm having all sorts of like conversations in my head, and I'll definitely be
Hmm.
looking into it further. So you've converted me into looking into it more. So yeah, well done.
Thank you. Thank you. My job is done.
Yeah, definitely. So in the terms of like mental health support, so like mental health professionals, psychoanalysts, psychotherapists, so for their clients who may be struggling with you know their gender identity or traumatic episodes, and how can they better support their clients in your opinion?
Yeah, one of the things that's crucial is really to stay with your patient. You have to sort of hold back from thinking you know the truth of your patient's gender, for example. You really have to stay with the language that the person you're sitting with is using about themselves. And in terms of validating someone's, sort of the language someone uses to describe themselves, this is actually doesn't mean that you just stay there. Like, you use their language and then you try to create a space where people can also get to, I don't know, think more deeply about themselves, ask questions about themselves, but you're not trying to get them to ask questions so as to undo their self-understanding. It's like to actually create a space of curiosity about themselves. But it's important. We are following our patients, and it's a kind of following that is also providing, it's a complex maneuver. You're providing like ballast support, some sort of holding at the same time that you're following. So it's not just they're out in front without support, right?
Hmm.
Really trying to help provide some mooring so that kinds of movements someone can make will not feel so like free fall. And I would say for someone who is struggling with their gender, it can also be difficult, complicated to find a good therapeutic fit, to find someone that you can trust will actually affirm you and provide the space for you to be in this process of exploration and becoming. And this is especially complicated now because there are therapists, psychologists, psychoanalysts that are actually skeptical of transness, but are using language in their self-description of their practices that sounds pretty fantastic. They speak about themselves as doing gender exploratory therapy. I mean, gender exploratory, like, that sounds good. I mean, I help my patients explore their gender. But the difference between like an approach that is making room for someone's actual transformation and becoming, which is a form of gender exploration, and a form of gender exploration is like, just keep exploring. Don't do anything.
Mm.
We're going to talk and talk and talk. No puberty blockers for you. No cross-sex hormones
Mm.
for you. Don't do anything. We're just going to keep exploring till we get to the bedrock of what made you think you're like this,
Yeah.
right? That's a gender exploration that is set up to stall someone, right? So I think it can be complicated if you are someone who wants to find a therapist. Like how do you know? Like, how do you find out if, the person you're working with is actually going to be supportive of your process and
Yeah.
not get in the way of it?
So for like going on from that, what advice or insights could you say for those individuals who are looking for a therapist? Like how would they know
Mm-hmm.
who to go for in the
Yeah.
first place?
Yeah, no, this can be quite tricky. So one thing you could do is, if you're in a community which has an LGBTQ center, you can see if they have a list of recommended practitioners. Maybe you have a friend who is in therapy, and that seems to be like very flourishing, and that person's been very supportive. Maybe their therapist can give you a referral, right? You can find out some other names. You do want to be, I think, mindful. There are certain things to be mindful of. If you see someone describing their work as gender exploratory, that is often a red flag that, in fact, it's going to be more conservative and even skeptical of transness, for example. So, you also get to ask questions. When you go in to meet with a prospective therapist, that first meeting doesn't mean you've signed up and there you are. You have to see that person. You're like handcuffed to this experience. You get to ask questions, and you get to have 1, 2, 3 initial sessions, if not more, figure out, like, is this the right space for me? Is this person someone I can actually trust? You don't have to stay
Yeah.
just because you started this process.
Yeah, I completely agree with that. I've had therapy several times, and sometimes you might go in there and think, okay, this is the one shot I've got, to help me. But your therapist, you're not always a match at the end of the day. And just because that person might not be a match for you, someone else might be, and you don't have to pin all your hopes
Right.
on one person. You do still have the ability to choose.
And the good news is there are, with respect to gender, to trans and queer issues, there are more and more therapists, including psychoanalysts, who are, gender affirmative, who are getting, sort of are skillful, have a history of working with queer and trans people. So we are out there. And, what you just said, Kyle, is also important, that sometimes someone's just not a match. And you may go to someone who actually, has like all sorts of credentials. You have no doubt this person's gender affirmative. This person can work, you really believe that they could work with you and not to be judgmental, provide a space for your own exploration, your own becoming. But they might still not be a fit. There may just be something about their style, right? So it's a goodness of fit is important with the therapist too. And as you just said, Kyle, this isn't just about issues of gender, that this is a very intimate relationship. And it's important that you're working with someone in which something can happen. And you might also not know after just a few sessions. It's a relationship that gets, deeper over time.
Yeah, definitely. Yeah. So what are your hopes for the future of gender studies and psychoanalysis in understanding the complexities of gender identity, trauma, and mental health?
I love that question. And here I'll answer maybe as a professor first. I've been teaching queer theory, LGBTQ studies for more than 30 years. And it's really humbling because my students, like my undergraduates, I teach both undergrads and grad students, but my undergraduates pretty much stay the same age. They're age 18 to 22. I keep getting older, right? So what's humbling about that is I'm working with new generations of students all the time. And the language they use for gender, their experiences are certainly different than my own. I'm increasingly older than my students. So I'm having to constantly be pressed by their different questions, their different concerns, their different understandings. So I am always challenged. I can't rest on the laurels of what I think I know. Oh, like I've read that book, I've written that book. Okay? I can't rest on that. And that's great because then I'm constantly seeing how gender isn't staying still. Like our cultural understandings of it, our self-understandings of it, what's possible. And that part is actually thrilling. For all of my genuine concerns about the attacks on transness that are underway in the United States and elsewhere, and these are profound concerns, yet there's something dazzling and wonderful about what the young people I'm working with are doing, how they are, sort of fabricating. And again, I don't mean this, they're sitting down and they're on their computers coming up with something. I mean, like the creativeness of how they are interacting with gender categories and becoming themselves in all sorts of ways. And the questions they're asking, it's really, I feel so lucky to be challenged in those ways that I can't just keep thinking I'm the expert because, I have some expertise. I'm the professor, but I don't know everything. And that's really important to learn, if not hard. It's hard, but it's important to learn.
The landscape is continually going through evolution, right? Like, I mean, that's just science at the end of the day. So yeah, it's really interesting to see all this, progress in the coming generations. So, do you have any upcoming personal projects or areas of research that you're interested in, or any work that you've done based from the book?
I teach full time, and I also have a small private practice, so I'm feeling pretty busy right now. But I have a longstanding project I've been trying to finish that's actually thinking about religion and queerness, and because some of my training is in religious studies, and I'm really interested in thinking about actually religion and religious life as also a resource for queerness and transness, and which can sometimes seem like a contradiction because certainly there are religions which are very hostile to queer and trans life. So I'm less interested in what a particular religion, let's say Catholicism or let's say evangelical Christianity, says about transness or says about homosexuality. I'm not interested in those doctrinal claims. I'm actually interested in how being part of religious community and religious practice, and it's the kinds of emotions and bodily expressions, like what at the sensory level, how a kind of I'll use the word a queerness of religious life, because we do things as part of religious communities that can be out of the ordinary of everyday life. How we can think about this as having a kind of a texture that maybe vibrates, resonates with something we might think of as sexual queerness or queernesses of gender, that how to think about like what are the affective, emotional experiences that we draw on and that come into our bodies, and how might religion be part of that? So I've been trying to finish this book forever, but have been waylaid with other projects like Gender Without Identity. So I'm hoping to get back to that.
Okay, great. Yeah, that sounds also really interesting to look at how religion plays a role in that as well. But for the last question, before I let you go, is do you have any last words of wisdom or for our audience? So some of them might be struggling with their gender identity or just with mental health issues as well.
Yeah, I mean, I think that there are, really to encourage people that there are some tremendous resources out there, both clinical resources and also there are community resources that that struggles with mental health, struggles around gender, which are not the same thing as mental health struggles, even if sometimes people may have, sort of mental health struggles alongside their struggles around their gender, that it's really important to find communities you can be part of. Obviously, I believe in therapy. I'm a psychoanalyst, but to find conversation groups, to find your allies, find your people, so that you feel less alone in this process and feel less alone in your struggles. Because it can be profoundly isolating to be going through mental health struggles. It can be profoundly isolating to be struggling with your gender and feel like you don't have people who recognize you for how you feel yourself to be. You just feel like you can't be yourself with other people. So I think finding a community is so crucial.
Thank you very much to Dr. Ann Pellegrini for appearing on the podcast today. Your insights have been really valuable, and thank you for coming on to Your Head in Mind.
Thank you for engaging so seriously with these ideas. I really appreciate it.